Greetings from Brainetainment, where we make learning a delightful experience. Welcome to our channel, the home of enlightening and engaging content designed to stimulate your mind and broaden your knowledge. Today, we're broaching a topic of paramount importance: the significance of regular screenings for prostate cancer, a condition that affects countless men globally. Knowledge is power, and understanding this disease can quite literally save lives. So, buckle up for an insightful journey as we delve into the significance of regular screenings for prostate cancer. To comprehend the importance of regular screenings, first we need to understand what prostate cancer is. Prostate cancer is a malignancy that develops in the prostate, a small walnut-shaped gland that produces seminal fluid in men. This fluid nourishes and transports sperm, playing a critical role in reproduction. Prostate cancer is one of the most common types of cancer in men, often growing slowly and initially confined to the prostate gland, where it may not cause serious harm. But how does it occur? Prostate cancer begins when cells in the prostate gland start to grow uncontrollably. Some cells may spread from the prostate to other parts of the body, particularly the bones and lymph nodes. This process, known as metastasis, can be life-threatening. Let's delve into the causes. While the exact cause of prostate cancer is unclear, we know that risk factors include age, race, family history, and certain genetic changes. Men over the age of 50 are at a higher risk. It's also more common in black men and men with a family history of the disease. Moreover, certain inherited mutations can increase the risk of prostate cancer. Now, let's talk about the effects. Prostate cancer can cause various symptoms, especially in its later stages. These can include difficulty urinating, decreased force in the stream of urine, blood in semen, discomfort in the pelvic area, bone pain, and erectile dysfunction. However, some men might not experience any symptoms in the early stages of the disease. Understanding these factors is crucial because prostate cancer can be serious, but most men diagnosed with it do not die from it. Detecting it early, when it's still confined to the prostate gland, gives a man the best chance of successful treatment. Now that we know what prostate cancer is, let's move on to why regular screenings are essential. So why are regular screenings for prostate cancer so crucial, you might wonder? Well, let's delve into that. Prostate cancer is a peculiar adversary. It begins its invasion quietly, often without any noticeable symptoms. Like a thief in the night, it can grow and spread undetected if left unchecked. That's where regular screenings come into play. Screenings act as our first line of defense, our lookout, if you will. These tests can potentially spot the early signs of prostate cancer even before symptoms start to manifest. And here's the kicker: early detection can significantly improve the chances of successfully treating the disease. Think of it as being forewarned. If you know a storm is coming, you'll have time to prepare and protect your home. Similarly, if prostate cancer is detected early, doctors can implement a treatment plan tailored to your specific situation. You see, when prostate cancer is caught in its early stages, the disease is typically localized, meaning it's confined within the prostate. At this point, it's often more manageable and less likely to have spread to other parts of the body. This is crucial because once prostate cancer spreads, it becomes much more challenging to treat, and the survival rates unfortunately drop significantly. Regular screenings can also lead to early detection of aggressive forms of prostate cancer that grow and spread quickly. Identifying these aggressive cancers early on can quite literally be a lifesaver, offering a fighting chance against this formidable disease. Remember, prostate cancer is the second leading cause of cancer death among men, but the survival rate is close to 100% when the disease is detected early and confined to the prostate. That's a statistic worth paying attention to. In conclusion, regular screenings for prostate cancer are not just about finding cancer. They are about finding it early when it's most treatable and potentially saving lives. They provide an opportunity to preemptively strike, to take control, and to plan ahead. Early detection can be a game changer in combating prostate cancer. It's not just a saying, it's a fact, and one that underscores the importance of regular screenings. Now, what does a regular screening for prostate cancer involve? Let's dive into that. The screening process for prostate cancer is generally straightforward, consisting of two primary types of tests. The first is a prostate-specific antigen test, commonly referred to as the PSA test. This is a blood test that measures the level of PSA, a protein produced by both normal and malignant cells in the prostate. Elevated levels of PSA can indicate the presence of prostate cancer. However, a high PSA level doesn't definitively mean cancer. Other conditions, such as an enlarged or inflamed prostate, can also cause elevated PSA levels. This is why the PSA test is typically followed by a digital rectal exam, or DRE. In a DRE, a healthcare professional inserts a gloved, lubricated finger into the rectum to examine the prostate for any abnormalities in size, shape, and texture. Now, how often should these screenings occur? Well, that depends on several factors, including age, family history, and race, as certain groups are at a higher risk. Generally, men over the age of 50 are advised to discuss the benefits and risks of screening with their healthcare provider to make an informed decision. For those at a higher risk, such as men with a family history of prostate cancer or African American men, discussions about screening might begin as early as 40. After the initial screening, the frequency of future screenings depends on the PSA level. If it's low, the screening might not need to be repeated for another 2 to 4 years. If it's high, yearly screenings might be recommended. It's important to remember that these tests are not perfect. Neither the PSA test nor the DRE can definitively diagnose prostate cancer on their own. However, together they provide valuable information that can guide further diagnostic procedures, such as a biopsy if necessary. Understanding the screening process can demystify it and encourage more men to get screened. It's a simple process that can make a world of difference in early detection and treatment. So remember, when it comes to prostate cancer, knowledge is power, and regular screenings are a key part of that knowledge. Despite the importance of regular screenings, there are myths that deter men from getting screened. Let's debunk some of these misconceptions and shed light on the truth. Myth number 1: only old men get prostate cancer. While it's true that the risk of prostate cancer increases with age, it doesn't mean that younger men are immune. Prostate cancer can affect men in their 40s and even 30s. Next up, myth number 2: if I don't have any symptoms, I don't need to get screened. This is a dangerous misconception. Prostate cancer often shows no symptoms in its early stages, making regular screening crucial for early detection. Third myth: prostate cancer screening is painful and embarrassing. In reality, the prostate-specific antigen test, or PSA test, is a simple blood test. It's not painful and it's certainly not embarrassing. It's a quick procedure that could potentially save your life. The fourth myth is, if I have prostate cancer, it's an automatic death sentence. This couldn't be further from the truth. With early detection and proper treatment, the survival rate for prostate cancer is quite high. In fact, most men diagnosed with prostate cancer do not die from it. Myth number 5. Prostate screenings lead to unnecessary treatments. The purpose of screening is to detect potential problems early, not to push you into unnecessary procedures. If a screening indicates a possible issue, your doctor will discuss this with you and explore the best course of action. And finally, myth number 6. I don't need to get screened if no one in my family has had prostate cancer. While a family history of prostate cancer can increase your risk, the majority of men diagnosed with prostate cancer have no family history of the disease. In debunking these myths, we hope to encourage more men to take charge of their health and get regular screenings. Remember, knowledge is power. Equipped with the right information, we can make informed decisions about our health. As we wrap up this enlightening discussion on prostate cancer screenings, let us revisit the main points we've covered today. Prostate cancer, a disease that predominantly affects men in their middle to later years, is a serious health concern worldwide. However, it's not an insurmountable challenge, especially when detected early through regular screenings. These screenings, as we've learned, are not daunting procedures to be feared. Rather, they are simple, straightforward, and crucial in the fight against prostate cancer. They provide an opportunity for early detection, which dramatically increases the chances of successful treatment and recovery. We've also dispelled some common myths surrounding prostate cancer screenings. No, they are not unnecessarily invasive. No, you're not too young to consider regular screenings if you're over the age of 50. And yes, these screenings can indeed save your life. In conclusion, regular screenings for prostate cancer are an essential part of maintaining your health. They're not just about finding potential problems, they're about providing peace of mind, about knowing where you stand and being able to take action if necessary. So let's put our health first and embrace these screenings, not as something to be feared, but as a tool for empowerment and longevity. Remember, your health is in your hands. Don't forget to subscribe to Braintainment for more informative videos. Stay informed, stay healthy.